One of the problems that I find when I'm working with chiropractors, and it's definitely chiropractic. Of course, I would really only know chiropractic profession as a chiropractor, but I would suggest that it's not true in the medical profession or podiatry profession, in that they base their care on the patient's biomarkers, the patient's test. They're straightforward. And they're taught the test. Most medical doctors, GPs, do blood work, EKG, and the x-rays that they do, if they do them, are really just for lung, and they're just looking for congestion, pneumonia, things like that. So now there could be other issues relative to these other providers, relative to their therapeutic protocol, treatment recommendations. Okay. But from the outside, that's kind of what I'm saying. Now, in chiropractic, it's not the same. And unfortunately, it's not, because this profession is so haphazard. It's very splintered, depending on what techniques you use, depending on what philosophy of chiropractic you want to practice, whether it's homeopathy, subluxation, chiropractic biophysics, functional capacity, 3 phases of healing. I mean, it's just all over the board, which is really bad news. And of course, that's why chiropractic's been limited in its utilization. The mass confusion. Well, part of the mass confusion is just in the doctors. And that one of the there's two major factors. There's two major factors that determine patient retention. And let's say, and here they are. The number one is conviction. That's number one. If you don't even believe in what you're doing, and I found most of the time, it's because the doctors don't even know. They don't even know all the biomarkers. They know the real brief biomarkers. They don't know the high sensitivity biomarkers, and they don't know the 3 phases of healing. That's what I found. So you can't promote something or educate a patient in something that you don't even know, or you don't know very well, or if you don't know it very well, you don't even have a deep belief in it. And that's the number one problem with chiropractors and patient education. And then the second problem is confrontation. And confrontation varies depending on the personality of the person. High sanguines and high phlegmatics have very low confrontation naturally. High cholerics, high melancholics have naturally high confrontation. But also the education naturally increases conviction or confrontation. Just when you become certain of something, you'll naturally take a stand for it more often than not. That's okay. So having said that, how does this relate to patient retention? Well, the what should be a typical scenario of just a classic good patient in chiropractic, and I'm going to use the model, the science of the 3 phases of healing. So what would be a classic model? And this is, we're not dealing with lack of conviction issues. We're not dealing with lack of confrontation issues. We're not dealing with doctors being afraid to talk about money or time, because those are the two confrontational topics, money and time. That's what the doctors don't want to deal with. Okay, so having said that, what would be a classic scenario that should happen with every chiropractor across the board, every doctor? Well, the patient should get treated for in other words, there should be standardization of the examinations, et cetera. And there's not in the chiropractic profession. So, probably the vital signs are the only standardization in chiropractic, to be honest with you. So when we look at patient, what should it be? Okay. So first of all, the patient should be treated for the inflammatory phase. Every patient that comes in has it. Every patient is in the inflammatory phase to some degree, or they would not be in. And patients don't come in when they don't have signs or symptoms. That's not what motivates them to come in. They have problems. They have inflammation, they have pain, etc. And the 3 most common symptoms are pain, muscle spasms, and restricted motion. Those are the 3 most common symptoms. Okay, and then of course the gateways, it's back pain, neck pain, and headaches. That's 84% of the reason patients come in. Neuromusculoskeletal extremities is 7. That's 94%, 91% of all the reasons. That's it right there. Back pain, neck pain, headaches, pain, muscle spasm, sure. That's 91% of why everybody coming in to see a chiropractor. Okay, that's what the market is saying. So anyway, having said that, when you plug that into the science of the 3 phases of healing, that model. So I'm going to say, and by the way, that is the only universal model. All these other models chiropractors use, subluxation, nobody else uses those. No, there's no other profession that uses any of those models. The only uniformed, agreed, science-based model is the science of the 3 phases of healing. And that's ubiquitous with every healthcare profession and every model, period. Because that's how we heal. There is no dispute on that. That's the physiology of how we heal, period. It doesn't have to do with a philosophy, nothing, okay? So having said that, patients should basically come in and get treated for their inflammatory phase, do the bowel markers. What are the bowel markers? The tests, whether it's pain, tenderness, inflammation, okay. That should be the therapeutic protocol. And then it'd be nice if they stay through the repair phase, because that's what's happening with every patient, no matter what, if it's 1 cell or 1,000 cells. The only question is it above threshold or below threshold to the patient? Meaning below threshold, meaning it's not affecting any of their senses, motor, sensory, sight, smell, nothing like that. That's called below threshold, but it's still happening. The 3 phases of healing are still happening below threshold. The repair phase is still happening, even if it's 1 cell that's been damaged and it's below threshold. That mechanism of physiology is still happening. And then, of course, when there's a lot of cells involved, now it gets to be above threshold. And then there's different sensitivity tests. Some tests are way more sensitive and pick something up faster. Some don't pick it up, or so you need to do a completely different test to find something. That's like to find a dynamic problem, you got to do a dynamic test. You can't do a static test to find a dynamic problem. That's kind of so when the average patient should stick through the repair phase, and then same with remodel. We know that tissue that's coming back in, however many it is, even if it's sub-threshold, we know that tissue, that type 3 collagen, which is the new collagen, type 1 is what we're born with. It's not as elastic, it's not as strong, which means if the patient heals that way, they end up with a permanent problem to some degree. Now, the question is, how much above the threshold do they heal permanently? That's the question. But they still heal, and it will be permanent. And of course, the goal of the physician is that when it does heal, it's below threshold. That's the goal of it. But it's going to heal abnormally. Abnormal tissue will not get back to 100% normal, period. That will never happen. It's the degree, it's the quantity and quality that will determine, and is it above threshold or below? And of course, the goal is to have it below threshold, so it doesn't impact the patient and with their activities of daily living, things like that. Okay, that's what the therapies. And so we look at the therapies. What therapies are we doing in the repair phase that justify, and remember, all of these should be quantified, because every time we do a re-exam, we should be able to quantify those tests that tell us if they're getting better, worse, or staying the same. So we do the test, we know what's happening physiologically in the repair phase. We do the test, and we know there's different sensitivities of tests. Some tests are totally irrelevant. Some tests are a little relevant. We call those secondary tests. And then some tests are what are called primary tests. So are we even doing the right test? And so that happens a lot of times. Doctors don't even do the right test. I have doctors that come to me that have not even ever checked overpressure range of motion. They didn't even know what it was. They just remember hearing about it in school vaguely. And that's one of the major tests. That category of mobility is one of the highest probabilities of a permanent problem with injuries, overpressure motion. And then same with joint motion. There's a lot of chiropractors that come to me, they don't even evaluate joint motion. They don't evaluate nothing dynamically with the joint. And remember, there's 3 ranges of motion. There's joint, overpressure, active. Most chiropractors are only evaluating active range of motion. That'd be like, somebody going to a cancer doctor and, there's 3 levels of cancer and he's only testing for the lowest, weakest level. He's not even testing for the medium or the higher probability cancers. He's not even testing for it. That's what chiropractors are doing. Because those are the most important tests. It's the overpressure test and especially the joint motion. Because it's the joint motion, that's the fulcrum of all the problems. And that's the fulcrum when it heals wrong. That's where it all starts. It starts in joint motion, and as it deteriorates, it gets worse. It starts going into active range of motion, and it starts eating or overpressure, and it starts eating into active range of motion at the end of active range of motion. You've seen older people that get old, and they can move 5-10 degrees. When they try to go into the furthest ranges of motion is when they can't, because it ate up, it ate up, meaning it degenerated and destroyed, reversing. It doesn't start from 0 degrees out. It starts from the full range of motion and starts decreasing the motion and causing pain coming in. So the first motion that somebody will lose is joint motion. Well, you won't even know it if you don't do the test. And so often chiropractors don't. And they don't know it. They haven't studied it. They don't know basics of a motor unit. They don't, they'll learn active range of motion. You should be able to go certain degrees forward, backward, left, and right. Almost every chiropractor knows that coming out of school. They don't know overpressure typically, and they don't know joint motion at all typically. And those are the most important tests relative to a functioning human, especially spinal problems. Remember, 99% of all spinal problems are biomechanical. They're not visceral. It's not cancer, tumors, infections. It's biomechanical. It's altered spinal biomechanics, and it's not in the gross range of motion category, overpressure. It's in the joint motion category. That's where it all starts, either from major trauma or micro trauma. That's where it all starts. And then as it gets worse, or if it happens with major trauma and it all happens fast, then it could immediately impact joint motion, overpressure, and active range of motion. And we see that when patients come in. They come in a lot of times, they do have restrictions in active range of motion, especially in the plane of injury. But that's not the starting point or the stopping point, but that's the point that typically the doctors are only paying attention to. So you have the repair phase that goes on, and then the remodel phase that goes on. And it happens whether or not you're helping the patient and doing therapy or not. That's what's happening. So they are going to heal normal or abnormal. That is a fact. So when chiropractors do not apply physical medicine to affect the joint motion, overpressure motion, active range of motion, and that patient does heal. Now, if they heal above threshold, well, they know it immediately. The pain and restrictions are there from day one with the activities of daily living. If it's below threshold, they don't know. You don't know. It still heals wrong. It's just below threshold. Now, the problem is with spinal is we don't know if it's normal or abnormal dynamically unless we take dynamic motion x-rays. Because so many times you can have all these other tests that are normal. You can even have a absolutely normal static x-ray, which is rare, by the way. Chiropractors know that. And abnormal motor unit, in other words, spinal biomechanics. Now we're talking joint motion. Abnormal spinal biomechanics joint motion. Because remember, that's the fulcrum. And it's such a bizarre, weird thing that the thing that most is important to chiropractors is the least taught in school. They'll teach you how to take the blood pressure. They'll teach you how to take the pulse. They won't go into and emphasize the most important test, which is the overpressure joint motion test, because that's where the problems start and that's where they end. And then it all deteriorates from there with the patient, depending on if they're normal or abnormal. And so my point is, if you don't have the conviction or know it, you can't explain it. You can't say it with conviction. You don't know it. And a lot of doctors, when they don't know it, they don't do it. So they don't even do the patient education. Well, you got a big problem as soon as you don't do the 4-day patient education. And I cover that separately. There's 10 major problems that go wrong that you totally violate the natural purchase pattern, consciously and subconsciously, of a human being when you don't follow those 4 categories, because all 4 of those categories were all based on 10 major concepts of how I like to buy products and services, and how I like to have information coming to me in a certain order. So soon as that lack of conviction occurs, if the doctor doesn't do it, or he bastardizes it, he takes pieces of it and he tries to shove it in day 1 or day 2 and do it day or whatever, it's over. It's over. It's not going to work, because the major concepts have been violated. And why did it all start? Well, it really all started because the doctor didn't have the conviction of understanding that they did not even do the tests that were most important to the patient. They didn't quantify them, evaluate them. And I was talking to a doctor the other day. I said, and he'd been doing patient education for about 6 months. I said, he couldn't explain simple biomechanics of a flexion extension x-ray or left and right lateral bending. He couldn't even explain it. I said, well, immediately when I know you can't explain something, you're definitely not going to be educating your patients on it. And if you're not educating your patients on it, you're not doing the tests that are the last test to heal. I know those patients are leaving without getting that care. They're not getting the repair care or the remodel phase of care to decrease the likelihood of those permanent injuries. That's what I know. That's what's happening to the patient. And it all starts from the doctor's lack of conviction. And the lack of conviction comes from his lack of studying or being aware of how this works. And I know that's hard to see if you're a chiropractic assistant listening to this. It's probably blowing your mind, and it should. And I say it all the time. They should not even hand out degrees without the chiropractor having a deep, thorough understanding of the 3 phases of healing. And they don't. And high and low sensitivity tests that determine each of the phases of healing, whether the person's getting better, worse, staying the same, or ending up with a permanent problem to some degree. And they don't. And that's a major problem with patient education, is doctors don't have the conviction. That's where it all starts. And lack of conviction starts with lack of knowledge. That's why when you see doctors who are educated in it, they get stronger and stronger in their beliefs, because they understand how it works. And when they understand not only how it works, but the negative ramifications for the patient. Because remember, every time the patient does not go through physical medicine in at least the repair or the remodel phase of healing, they are ending up with permanent collagen and neural issues to some degree. The question is it above threshold or below threshold? But that doctor is allowing permanent problems to be set up with that patient, period. That's a physiological fact. Even if the person already had permanent problems, they're just allowing another layer, and I kind of call it like an onion, just like laying another layer of permanency with the scar tissue and the neurology. And of course, that's what affects the spinal biomechanics. It's not just ligamentous lesions, it's the connective tissue, loss of elasticity, or this is what alters spinal biomechanics. And of course, altered spinal biomechanics is the absolute precursor to, it goes right down the steps to abnormal movement. Abnormal movement sends all kinds of alarms off in the body: pain, muscle spasms, degeneration, wear and tear, which eventually leads up to osteoarthritis, the #1 disability in the United States. 1 in 5 people have debilitating disability of osteoarthritis. 1 in 5. And that's people who have already are at the end stages. Well, there's still a massive amount of people that are headed where the end stage is. They're headed in that direction. They're in the spinal degeneration phase 1, 2, or 3. Okay, that's the problem. It's all and that's why a lot of times when doctors and the in the profession, the best source of research material that creates the conviction. I mean, I can explain it. I don't cite resources and, peer-reviewed journals and all that. I explain it from like just a blue collar layman's standpoint, but that's chiropractic biophysics. They did all the research. They have all the tools. They've got all the peer-reviewed journals. And their whole technique is based on the science of the 3 phases of healing. And they put a lot of emphasis in the rehabilitation and the structural movement. Because what happens is if the patient ends with abnormal motor unit in that at the end of that remodel phase, even though all the other tests are normal, we know that's leading to permanency. We know all of this is coming back. We know that abnormal motion is going to start creeping in, it's going to start causing pain, muscle spasms, restriction, degenerative changes, wear and tear, osteoarthritis. And so it starts eating into the person's activities of daily living, working, sleeping, bathing, showering, dressing. And then we know as chiropractors, it starts eating into their behavior, their attitude, their outlook on life, how they treat their spouse. And how did it all start? It all started with minor trauma, macro trauma, that they did not heal as optimally as they could with physical medicine and all 3 phases of healing. That's how it all started. And so now here come all the drugs. And though that's why all the drugs, that's the number 1 selling drugs, NSAIDs for osteoarthritis. That's why. Okay, so that's chiropractic's huge potential role. Are we anywhere helping to any dent in that? No, not at all. Only 8% of the population seeking chiropractic care. And of those people, I don't know of a statistic, but here's what I do know. I will guarantee 8% of those patients are not being educated to go through the science of the 3 phases of healing. I will guarantee that. What does that mean? Whatever 8% that aren't, they are definitely creating permanent problems to some degree. The question is whether it's subthreshold or above threshold. That's what's going on. So one of the things that I suggest to chiropractors is that the best thing you could do for patient retention is first learn it. First learn how the body heals. And I would actually take the first course of chiropractic biophysics. Now, you do not have to get certified. They have a certification. I don't know how many weeks. It might be 4 weekends or something like that. Because it's not only understanding the research and the physiology, to a great, great degree. It's the therapeutics. What do you do and how do you do it? So, I don't necessarily think it, but I tell you what I do notice. Doctors that come to me who have been to chiropractic spinal biophysics have no problems implementing implementing the science of the 3 phases of healing with the patient education and the 4 days of patient education. They have no problem with it at all, generally speaking, because they know it. It's a conviction. They know how it works. Not just how it works, but they know that if they don't do it, they're helping to lead to permanent problems because of their lack of conviction or confrontation. That's what's happening to these patients. Just like if a family member went, there were 3 tests for the cancer, the doctor only does 1, it's the weakest test. This is what the majority of chiropractors are doing. They're not even doing the most specific test for cancer, the 2 other tests for that cancer. They're not even doing it. And those are motion study tests and overpressure range of motion coupled with dynamic orthopedic tests. Those are essentially the main findings of joint dysfunction. And that's what we deal with as chiropractors. We deal with motor unit joint dysfunction. That's essentially what we're treating. when we treat all these conditions, back pain, neck pain, and all this stuff. Okay, so that's one thing. And then what I'm actually going to do is I'm actually going to put a series together, actually going over the x-rays, because I still have doctors who don't take the x-rays, they don't look at the x-rays. They still don't even know how to analyze a motor unit, a pathological motor unit. And so that test isn't even done. And I say to that doctor, are you okay with a family member having cancer and the doctor only doing one of the 3 cancer tests, and the second and third test is way more important than the first one, but the doctor doesn't even do it? Are you okay with that? That's what the chiropractors are doing when they don't even check motion studies as the main test of the progression of spinal related problems. That's what's happening. You can call it unethical, immoral. It's not that as much. It is if the doctor knows better. Most doctors don't know, and that's the reason they don't do it. So they're not educated. And it's no different with me. I came out of school, I just knew active range of motion and symptoms. So how good was I communicating with patients with patient retention? That's terrible. I was terrible. Like all the chiropractors coming out, terrible. And then I started studying spinal biomechanics and the 3 phases of healing, motor. I'm like, oh, that makes a lot of sense. I'm not even doing the tests that are showing the problems. Well, I started doing the tests. I started paying attention to the tests that were way more relevant, specific to spinal problems. That's like I told you, it's joint motion studies. It's motion studies, way more important than static x-rays. Number 1. Number 2 is overpressure. Number 3 is the orthopedic tests that are dynamic, that go into 1, 2, or 3 planes of motion. That's where these problems, along with, you can add in there palpation, fixation, and tenderness. That's like the 5 big tests that really show motor units. And so we know that if all these other tests are normal, symptoms, tenderness, all that, orthopedic tests, muscle strength, but we do that motion study at the end, toward the end of the 3 phases of healing. Because remember, you got to allow the patient to go through the 3 phases of healing with physical medicine to decrease the likelihood of a permanent problem. So that's why we do the motion studies and the first re-exam, and then 3 months later, because 3 months is the earliest you'll see physical changes with physical medicine. And the frequency has to be at least 2 times a week. That's why you gain no muscle mass if you work out once a week. You won't see any difference 3 months later. Marginal to none. That's the importance of it. So I paid attention to all the tests, symptoms, all that. But the absolute single most important test is when I was going to do that motion study 3 months later. And I let the patient know that. I'm like, this is the most important test. It's kind of like you. Wouldn't you like the doctor know that if you had a family member or yourself that had cancer, wouldn't you want that doctor to say, out of all these cancer tests, this one right here is the most important one, and it's going to be the end game. This is the end game of if you have cancer or not, right here. Wouldn't you want your doctor to show you that or explain that to you, or at least do the test? Yeah, that's called common sense. It's called ethical, and it's called moral. So that's the same with spinal biomechanics. The only way you can actually see normal motor units and whether it's moving normal or abnormal is the motion study, whether it's flexion, extension, or right lateral bending in the neck, or left or right lateral bending in the low back. Those are the common tests. Those are the last tests that'll clear up. And those are the last tests that'll be done. And the very earliest that you can actually do that test with physical medicine and see a change is 90 days, 3 months. I go, how many doctors are actually doing the test? I hate to say it, but I would never refer a family member to that doctor because he's not doing the number 1 test for the number 1 problem. And I know that. And I would never refer a family member to that doctor because I know that person's going to heal abnormal to some degree. Now, whether it's above threshold or below, that's a whole nother question. Again, that depends on how much the doctor takes him through the repair phase. He doesn't even do physical medicine in the repair phase. We definitely have permanent problems, in all likelihood, above threshold in overpressure dynamic motion. Permanent. Almost every time. That's just physiological fact. The chiropractors don't know it though, because they don't test it. They don't even do the test. So if you don't even do the test, you don't even know if anything's wrong. That's what's going on. So the very first thing you could do to increase your patient retention, and again, getting back to what I talked about, is what would be the normal path of a patient that they should take if the conviction of the doctor was not a problem, if the confrontation of the doctor was not a problem, if money and time was not a problem. What's the normal path? Well, the patient should go through all three phases of healing. They should have the therapeutics for inflammation and pain, right? For the inflammation phase. And then they should have therapeutics to increase their active facet and joint motion in the repair phase. And then they should have therapeutics to increase the strength and elasticity of type 3 collagen in the remodel phase as much as possible. And then the patient reaches MMI. There's two, there's two exams, they don't get any better. Hopefully, when those two exams are done, the patient is below threshold in all the tests. That's the goal. Okay. So now, is that the typical? No. The patient should still receive lifetime care. Now, it's not maintenance care. It's lifetime. You go, well, why should the patient receive why should they receive lifetime care? Well, they don't necessarily need lifetime care if they're not active, if they don't move. Well, that's not even reality. We live dynamic lives, meaning there's macro and micro traumas happening every day. I'm sitting here right now as you're looking at me in abnormal ergonomics right now as you're looking at me, my back, etc. Okay. Well, it's no big deal from one day to the next. That's called macro minor traumas, macro traumas. Doesn't cause a problem from one day to the next. Go and have abnormal dynamics day after day after day after day after day, and that's what causes pathological changes. And remember, that's the number one reason for the number one workers' compensation injury is repetitive micro trauma. It's not a major trauma. It's repetitive micro trauma. So, and we get patients like this. It's not just always one big trauma. It's repetitive micro trauma. So why do we need lifestyle care with chiropractic, physical medicine? Because we live dynamic lives. We're constantly going off the midline. If everything we did was totally 100% ergonomic dynamically, we wouldn't need any care at all, period. That's not reality. The reality is after we heal in the three phases, we're living dynamic lives with micro traumas happening all the time. And we just don't know it day to day. Like right now, I mean, I know it because I know ergonomics and I know where my body's positioned right now. That's why I can tell you this. But this is why lifestyle care is important. And lifestyle care is very focused. It's focused on a problem. It's focused on a solution. It's not maintenance care. Lifestyle care is very focused to help minimize and eliminate dynamic neuromusculoskeletal spinal related problems, which are the number one incapacities and disabilities in the world. It's a big problem. Okay, so anyway, I just wanted to share with you that that's it. And the reason I didn't have trouble with my doctors with patient education, well, I did when they first came in because they were doing the same thing every other chiropractor, or they weren't doing all the higher sensitivity tests. They didn't know the three phases. They couldn't even explain them. They didn't know the differences in tests as they didn't know the difference between a high sensitivity and a low sensitivity test. So when they first came to me out of school, they were bad. I wouldn't refer any of my family members to those guys, those people. What changed it was a couple things. Number one, I taught them the basics of spinal biomechanics. I taught them the basics of research, but that's not what had the greatest impact. What had the greatest impact was every day we evaluated patients. So it wasn't just a webinar once a week or a webinar once a month. Every day, first we explained it all, then we went through the patient, went through their history, and I go, okay, based on these findings, what phase of healing are they? Okay, then I go, what were the biomarkers? What were the primary biomarkers for the inflammatory phase? What were the secondary ones? Okay. Then I go, what therapeutics are you going to use for those primary or secondary biomarkers? And how does that therapy work to help that physiology? See, this is how I trained my doctors. And then that's what we apply. Okay, let's go ahead and apply it. And then let's leave it there for 12 treatments. We're going to re-examine the patient in 12 treatments. Okay, so we re-examined the patient 12 treatments later. We pulled up the new exam. Then we compared the test to the first test. We go, okay, let's look at the first test. Where do the second test stand relative to the first test? In other words, they could see it. They could experience it. It was conviction. It was now happening to them. It wasn't just pie in the sky. This is how I created conviction doctors. And knew what they were doing and could justify what they were doing. So then we would go, okay, what phase of healing are they in? Are they kind of out of that now? Can we now pay attention to the second phase of therapeutics? Okay. What were the positive findings that we found in the second phase? What were the biomarkers and what were they quantified? So what therapy are you going to do and why are you going to do it based on those biomarkers relative to the science of the three phases of healing? This is a conversation I had this happened every day. And then we watched again. We okay, treat them for the next 12 treatments. Let's go ahead and check them at the next re-exam. We went to the next re-exam. I go, okay, let's look at the biomarkers. Where do they compare to the last? And how do they compare to the first set? So, so now we're seeing tests in the first set that are totally normal now, are sub-threshold. And then we're seeing tests from the secondary exam that are diminished. And some tests that were more severe, more diminished. So in other words, the patient's progressing, getting better as they're going through the three phases of healing and the proper therapeutic protocol, because we know physiologically what's happening. Then we did it again. So by the time we got to the third phase, we are looking at the physical medicine to increase strength and elasticity, because that's what we're mainly dealing with in the remodel phase. And that's what leads to permanent problems when the patient heals wrong, the collagen heals wrong. These fixations, chiropractors know them as fixations, abnormal pathological motor units. That's the number one cause of the number one disability in the United States. The only difference is the cause and effect relationship, maybe 1, 2, 3, or 5 years. That's the only difference. Just like smoking is going to kill 25% of the people that smoke. If it killed them the day they smoked the first cigarette, most people wouldn't be smoking. But they continue to smoke because they don't see it for 20 years. But 20 years later, 25% of them are going to die from that. Well, that's what the tests, same thing. So we're paying attention to these tests. So I know I know the problem, I know the mechanism of injury, we know the healing. We go, well, wait a minute. Out of all these tests, which ones are going to be the last ones to clear up based on physiology? Well, we know joint motion's the last, it's the most important, and it's the last one to clear up. Well, the doctor won't even know it if he's not doing motion studies. He's not doing the most important test for that patient, for that problem. What's the next one? Fixation, tenderness, overpressure. All of those are very highly specific for motor unit dysfunction, but the number one is taking that motion study, going, look at that motor unit. Is it moving normal or abnormal? Because it doesn't matter what else is going on, even if nothing else is going on with that patient. I see abnormal motor unit. I know, just like if my car is out of a line, I know I'm going to have a blowout, flat tire. I know I'm going to have problems. And if I see those motor units abnormal, I know that pathological process is still there, and it's going to surface to threshold. In other words, where they actually start feeling it again. That's what's going to happen. So it's not just based on how they feel. Just like cancer is not just based on how the patient feels. They actually do tests that the patient can't detect and the doctor couldn't detect unless they did the test. And some of those tests are way more important than others. And that's the relativeness of motion studies done 3 months down the road. That gives the earliest indication of the true sense of that patient and where they're at, combined with physical medicine. You can't just not do any physical medicine and then re-x-ray them down the road. I'm like, no. And by the way, a major part of the therapeutic protocol should be the doctor evaluating the abnormal spinal biomechanics of the motor unit, because that is where the physical medicine should be applied. Well, how does he know where to apply that physical medicine if he's not even looking at an x-ray? Well, one way is a fixation, right? Tenderness fixation, overpressure. That helps to isolate that area. But what's the absolute definitive test? It's the motion study. That's it. So again, how would you like you or a family member having cancer and the doctor doesn't even do the highest sensitivity, the most important test that actually tells you if the cancer's gone or not? How'd you like that? Well, chiropractors are doing that they're doing it every day. That's what's happening when you don't explain this to the patient, called patient education. And then you don't give and make it affordable. Remember, we're all about treating patients with respect. We're all about giving patient education, because the average person that understands this, that it's affordable to them and you don't waste their time, will say, yeah, I totally want that, because I don't want these permanent problems to suddenly read the rest of my life. And I would like to get this care. Now, by the way, the lifestyle care is built on the 3 phases of healing, but it's not in the 3 phases of healing patient education. So don't confuse that. And you cannot try to do that. It's separate. So after the patient goes through the 3 phases of healing, they get educated on the lifestyle, and it's not maintenance care. Okay. So the normal patient, if it's affordable and you're not wasting their time, they should go through the inflammation phase, the repair phase, the remodel phase to decrease the likelihood of any permanent residual problems, and then sign up for the affordable lifestyle plan, because they're always going through micro traumas in life every day. And sometimes, wham, they get a major trauma. Most of the time it's micro traumas. And this is what is constantly treated and monitored as they go through this thing called life. And that's what increases quality of life. No pain, decreased no pain, no restrictions, highest mobility, the best chances of doing your activities of daily living fully and freely with no pain or restrictions, which now does not have a negative impact on your attitude and your relationships. That's chiropractic. That's what it should be. If the doctor had conviction, 1, confrontation, 2, knew how to communicate patient education, 3, knew the physiological differences in the 3 phases of healing and therapeutic protocol, 4, and then knew the biomarkers and the therapeutics of the lifestyle care, combined with the education and making it affordable and respecting the patient's time, 5. And all patients would pick that. Overwhelmingly, the vast majority of patients pick it when you educate them properly, like what we do. It's all reverse engineered of how we buy products and services. It's not one person's opinion. It is not my opinion. It's all reverse engineers of how consumers buy stuff. That's designed on how I buy stuff, what I want consciously and subconsciously. And so this is where the problem is with patient education with doctors. First, there's a conviction issue that leads to a confrontation issue. Then it leads to a communication issue. The doctor's typically not good at communicating and delivering. All of these are skills. All of this needs to be trained in and educated to increase your quality of care you're giving to the patient, for them to accept it, and then make it affordable, respect their time, treat them with courtesy and respect, and allow them to make informed decisions. That's what every patient should be given. And if you or a family member had cancer, that's exactly what you'd want. If you had any type of problem from any service provider, that is exactly what you would want. You would want to be treated with courtesy and respect. You'd want to be informed. You'd want to be led. You'd want to be allowed to make your own decision. You would want it to be affordable, and you wouldn't want the person to waste your time. That's how you and I want to buy every product and service in our life. That's what the doctor should attain to. And of course, when you do that, the higher you increase your skill levels, your conviction through education, your confrontation through education and application, your communication skills, that's what we do here. All of this is done here in this webinar, only for the doctors that participate. And unfortunately, most of the doctors won't participate. That's when you give the patient, that's when the doctor is at his best as being a doctor, communicating, giving the best therapeutics, interpreting the therapeutics, giving the best response to treatment, making it affordable, respecting the patient's time. And that's how I trained doctors when they came through my office. And that's why when they left, we never had patient education problems, because that's what we worked on every day. We worked on their communication. We listened to the recordings to see how they were talking, how they were listening. We paid attention to the patient's biomarkers. We paid attention to the mechanism of injury. We paid attention to the therapeutic protocol relative to the biomarkers and what phase of healing they're in. And then we paid attention all the way through all the biomarkers, even at the end. We evaluated their strength and elasticity. And then we looked at the biomarkers, the most important biomarkers at the end, at MMI. And that is, or the soonest that you'll see changes on an x-ray, 90 days with physical medicine. That's the most important test a patient will ever have. And these are the tests that are typically not done by chiropractors. The people who are supposed to be specialists in this: motion x-rays, overpressure joint motion, orthopedic tests, which specifically focus on that anatomy in 1, 2, and 3 planes of motion, point tenderness. Those are the tests. Those are the most fixation. Joint motion is the most important. Overpressure, fixation, point tenderness. Those are the most important tests that should be done at the end of care and be normal. And they're not being done. Mostly the x-rays. And mostly because the doctors haven't studied simple spinal biomechanics relative to the science of the 3 phases of healing, relative to physical medicine. And so that's why the doctors aren't doing it, because they don't know it. So how do you change that? Well, you change it in the reverse. You study it first, like what I did. I taught it first. Not just once, not just hear about it. We actually learned it. So we learned the physiology of the 3 phases healing 1. Then we learned what tests were most likely positive in these phases, how to quantify them, right? Then what therapies do you use to decrease that abnormal physiological function? How does it work? How would you, okay? And then we moved them through, measured them every 12 treatments. That's called a re-exam. That determines if they're getting better or staying the same. And do we need to modify the therapy or totally change the therapy because they've moved into another phase of healing until they reach MMI. And then the last test we can do, even when all the tests are clear, I'm going to see the patient as a minimum of twice a week until we get at least 90 days down the road because that's the earliest that I'm going to see physical changes on a motor unit with physical medicine. And there you go. I'm going to do that test. And when I do that test in the remodel phase, all right, that's going to tell me a significant idea of what's going on with this patient. Is this problem going to come back? How much has it improved? Or is it still there to some degree? Because I know wherever that motor unit is, if it's not normal, it's coming back. How much of abnormal it is too depends on how quickly it's going to come back. And that will determine, well, if I continue to see improvement, I'm going to continue the care. They haven't reached MMI. So we'll keep the physical medicine going until I recheck them again 90 days down the road. I'll do the test, the re-exams, but remember, I don't want to do another x-ray 12 treatments later. Again, it's 90 days with physical medicine. So as long as I keep seeing improvements, I'm moving. We're going to keep riding this thing up and helping this patient get back to normal as much as possible. And then I see a plateau. Okay, we're in the 3 phases, remodel phase or past it, and we see a plateau. I'm like, okay, we're at MMI. Now we switch them to lifestyle care. That's not maintenance care. That's what's optimal. That's what all this is about. It's giving the best care. It's treating patients with respect, being friendly, leading them. We want to be led when we go somewhere we're not familiar with. Informing them. We want to be informed. When I make this, before I make decisions on stuff I don't know about, I want the person to inform me the pros and cons and what am I looking at here? That's what I want as a consumer. Respect, courtesy, leading, inform them, allow them to make the decision. Our patients make their own decision after they're informed with the process and time and money. That's good service. And then we make it affordable. And remember, we can make it affordable for all 6 socioeconomic classes. Well, remember, 5 out of 6 can afford care. They just need a payment schedule. That's all. Even the 6th class can still afford care, but now it's exchange of services. They don't have the money. You might be washing the windows or something. So we can always make it affordable. And then we want to respect their time. No, we don't want them to wait. We want them to be able to get right in, go back, get treated, and leave. Because they got to take their kids to soccer. They got to go to grocery store. They don't wake up in the morning going, I can't wait to drive 22 minutes to the chiropractor's office. Wait in his office 10 to 15 minutes. Spend 20 to 30 minutes getting treated. And then another 22 minutes going home. And I want to do that 3 times a week. That is not how patients wake up. So we want to be absolutely at our highest in all of these categories. Friendliness, information, leading them, allow them to make the decision, respecting them, making it affordable, respecting their time. That's quality service. That's what keeps patients. And that takes effort on the doctor to learn these things. Takes effort to learn the biomarkers because they're not taught in school. Chiropractors do not come out of school knowing this. They don't come out of school knowing how to communicate with patients. They don't know how the different styles of communication. They don't even know it. And so you get this random crap, bad service, patients just leaving left and right. Not even understanding what's going on, ending up with permanent problems to some degree the rest of their life. That's the majority of chiropractors. That's called crap. Just like you would not want it for yourself, your mother, your father, or your brother, or your sister. That's why we pay attention. That's why we train to give that service at all those levels. And then we get the reward for it. The personal satisfaction is amazing. It's a phenomenal profession from a positive feedback system. When I help patients go through all these cycles and they just get better, and their quality of life just goes up and up and up. I mean, there's not a whole lot more that, unless you're into salvation and saving souls, there's not a whole much more to life, helping your fellow human being live a higher quality of life, physically and emotionally. And that's what happens. And then, of course, you're rewarded by the financial aspect also. So it affects your potential quality of life physically. Okay, anyway, I just wanted to make sure I touch on that because unfortunately I'm seeing too many clients, A, don't even put the time in to know the 3 phases of healing. B, don't put the effort in to learn to increase their communication skills, active listening skills, none of that. Don't put the time in to give good service, how to be respectful, courteous, and lead the patient and inform the patient. Don't even do that. Don't even put effort into making it affordable. Don't put effort into respecting the time and efficiently getting them in and out of the office. All of these are major deficits that are not trained in chiropractic college. That's what we're doing here. That's what this is about. That's what the patient education is about that we train. That's what the videos are about. That's what the seminar workshops are about. That's what this webinar is about. It's about hitting on all those calibers to increase the doctor's skill level, knowledge, ability. Why? So he can deliver a much better service. That's why. Wanted to take time and point that out because I'm seeing a lot of doctors missing the boat. Totally missing the boat on this. They just don't see the picture that I just laid out. And they don't because they're too limited, because it all started with them not even knowing the 3 phases of healing. They don't even know them. And then the biomarkers relative to what's needed, and especially the consequences to the patients. All right. I'm going to, one of the things that I'm going to do because of this. Now, one of the things I just shared with you, what I did with my doctors to train them to increase all of these categories, but it was on a daily basis, interactive. So one of the things I do recommend is, number one, go to the first seminar of chiropractic biophysics. They go into the research of exactly what's happening, all the soft tissue, the ligaments, the tendons, physical medicine. It's one of the best seminars you can go to feel good about what you're doing as a chiropractor. Number one. Number two, you have to pay attention to your communication skills. And you will not be able to do that without recording yourself. And we see it day in and day out. We'll listen to recordings and the doctor thinks he did a fantastic job. And we'll see problem after problem after problem. And the doctor did not even have a clue. Did not even have a clue that it happened. You can stay the same or you can increase your skill level to increase your quality of service to your patients. That's what it's about.